Hey gang, hope you're doing well. This will be chapter 19. Okay, the eye. We'll start with that. We'll break it up into some smaller segments so you'll have different videos. We'll go off the same presentation throughout, but again, we'll break it up into different sections. So we'll start with chapter 19, the eye. Here you can see there's a variety of different injuries and conditions and reasons that we see damage to the eye. Fortunately, eye injuries are relatively rare. However, um, most eye injuries are very, very significant. So the purpose of this is really just being able to understand and recognize and kind of know what to do when you see some of those injuries. So we'll start with bony anatomy. You got the frontal bone, all right, which is your eyebrow. The zygomatic bone, which is kind of the outside, the lateral aspect. And then underneath we have the maxilla, so think cheek. So those are really the three bones that come together: frontal up top, zygomatic to the sides, and maxilla. Below that, we have a series of, these are very small, very thin bones that make up kind of the underside or the bottom of the socket. If we think of the eye socket as a bowl, this would be the bottom of that bowl. Those are made up of the sphenoid, lacrimal, ethmoid, palatine bone. Again, those are very small, very thin. Our frontal, our zygomatic, and our maxilla, those are much stronger. Okay, so they kind of provide that outer rim. We call it the orbital margin. And then the orbit would be underneath. That's the sphenoid, lacrimal, ethmoid, and palatine bone. So again, a lot of bones coming together. We see a lot of different fractures and a lot of different, based on getting hit, getting punched, things thrown at you. There can be a lot of different fractures because of this very unique anatomy. The eye itself, a few main parts. Number one, we've got the sclera. Okay, the sclera is the white of the eyes. We've got the lens that is held up, okay, by these suspensory ligaments. So the lens can get stretched, it can become more compact, but the lens helps focus the light as it comes through. What allows that light to come through, what controls kind of the opening or the closing, think of it like the camera lens. That's our iris. Okay, the pupil is the hole in the middle. The cornea is that outer protective layer. Okay, it's kind of almost like a hard plastic. So the cornea is the outer protective layer. It's got a little bit of a bulge to it. The outermost layers are conjunctiva. It's kind of this mucous membrane. So we go conjunctiva, cornea, and then sclera. Sclera is fairly soft. Inside the eye, we have the vitreous humor. It's almost all liquid. And then at the back side, we have the optic nerve. Okay, the optic nerve is going to connect to the brainstem. That's what transmits the signals. And then we have the choroid plexus, which is kind of the blood vessel network. The retina is on the back. We'll talk about that in a bit. Here's another picture, just kind of shows some different images. We have the optic nerve, the sclera, there's the white of the eye, the vitreous. That's kind of the fluid that makes up the middle. The iris, there's the front, it opens, it closes, opens and can constrict, control how much light gets into the eye, goes through the lens, everything gets focused to the back. Here we have the optic nerve, right where those nerves enter, that's a blind spot. We'll get to that in a second. But again, light comes in, goes through the iris, gets focused through the lens, and then it hits the different spots. This is on the back. There's where you have the rods and the cones when we talk about color blindness or color vision. That's what we're looking at. And the entire eye itself is surrounded by conjunctiva. And then these are just different muscles, okay, which help rotate the eye. We'll talk about in a second. Main parts I want you to be aware of, though. Globe is the eyeball itself. Sclera, that's the whites of the eye. Pupil, the dark center. Iris, there's their color. And then conjunctiva is the mucous membrane, just to help keep the eye itself clean. Cornea, anterior membrane, this is the protective device. Lens help us focus that light. The back of the eye, there's our rods and cones. Choroid or choroid plexus, that just provides the vasculature, so there's our blood vessel. Whoops. And then optic nerve, that transmits the visual signals. Okay, it has no rods and cones. That's our blind spot. What helps our eye move? There's 6 muscles. 4 rectus and 2 obliques, which help us move in the cardinal directions and then also to rotate. All right, visual acuity is how we look at or how we examine the quality of vision. We consider this idea of emetropia, which is 20/20 vision. Okay, it's always me versus normal. Okay, so 20/20 is me versus normal. I can see at 20 feet what someone else can see at 20 feet. Myopia is nearsightedness, meaning you can see things that are close to you. All right, so you have near sight. You can see those things that are close. Hyperopia is farsightedness. You can see things that are far away. Myopia, much more common. So nearsighted, we can see things close up, but we have difficulty seeing things far away. And farsighted, we can see things far away, but we have difficulty seeing things close up. So kind of 2 terms to keep in mind. Certain questions you want to ask, things when you're faced with or confronted with an eye injury. Couple key things. Diabetes can cause retinopathy, so it can cause some changes within the retina. So expect some of those changes with a diabetic patient. Nystagmus is jumping or kind of a jitteriness. Photophobia, sensitivity to light. If the eye is itchy, we call that a chemosis. All right, so there's some different conditions, different things, different specific questions you want to ask. When we inspect, okay, so the periorbital, that's around the eye socket, look for any discoloration, so that bruising, a black eye, or potential gross deformity, swelling. Here we have an MMA fighter after a fight. That's what I mean by the gross discoloration, gross deformity. We can see a cut there. We can see a massive amount of swelling. So all things to look for when examining the eye. With the eye itself, in ophthalmos, the eye is sunken. Exophthalmos, the eye is bulging. Okay, and certain medical conditions can cause one or the other, but in ophthalmos, the eye is sunken in. Exophthalmos, the eye is sunken out. The eye bulges outward. A stye is an infection of a sweat or oil gland. Many of you have probably had those. They can be a little bit irritating. Oftentimes they'll go away on their own. Usually just holding a warm washcloth on the area opens that up, can draw that infection out. Cornea should be nice and clear. Any cloudiness can show a pressure change, or hyphema is actually blood within the cornea. That's what I mean by that hyphema. So we have some blood. So there's been some bleeding within the eye and it collects in that anterior chamber. Okay, normally we want that nice and clear. If you've heard of maybe your grandparents that have had cataracts, that can be some cloudiness in that cornea. The globe itself, okay, so the eyeball. Things we want to look for, the conjunctiva, foreign body, you might see some dirt, some dust. A very common one, think about the football field, and those little black turf chunks can get in there. You can actually get a bruising or bleeding on the eye. That's a subconjunctival hematoma. If you can see things on the eye, so example, that rubber chunk, you can try and get a Q-tip to remove that. Other things to look for with the globe itself, anisocoria is uneven pupils, or a teardrop pupil can indicate a ruptured globe. So this would be a subconjunctival hematoma. Sorry, I'll move those around. So again, just bleeding on the eye. And then a teardrop pupil, this is a major medical emergency. Okay, so when we see that teardrop pupil, that indicates serious damage to the eye. Great slide to review palpation. Functional assessment, things we can use. Snellen eye chart, so think of the chart you use at the eye doctor. being able to read signs close up, being able to read text close to you. You also want to always assess monocularly, so it's with one eye, or binocularly, that's with two eyes. And if they wear contacts at the time, please note. Eye findings: diplopia is double vision, or presbyopia is loss of vision due to aging. Pearl stands for pupils equal and responsive to light. Okay, so there we can see one eye compared to the other eye. An example of this would be the anisocoria, or the uneven pupils. When we see that, typically indicates head trauma. Okay, so that uneven pupil response, so a change in Pearl can indicate head trauma, so think concussion. We'll talk about that in chapter 21. And then when we look at the eyes, they should be smooth, they should be symmetrical. I've got a couple videos about nystagmus on Moodle. You can see that's really just a jumping or a stuttering of the eye. Cranial nerves. All right, we have 12 cranial nerves. These are, I want you to know, be aware of. These are things that will come back to you. These are just good clinical skills. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, auditory, glossopharyngeal, vagus, accessory spinal, and hypoglossal. In the far right hand, that tells you what they do. So olfactory is smell, optic is sight, oculomotor moves the eye side to side, trochlear moves the eye up and down. Trigeminal is sensory, specifically with the mouth. Abducens look at the eye side to side, so being able to track laterally. Facial moves facial muscles, so being able to smile, being able to grimace. That would be the facial nerve. Auditory, think hearing, so rubbing your fingers up against someone's ear or snapping. Glossopharyngeal, the best way to describe this cranial nerve controls swallowing. Vagus is known as the wanderer. It does a lot of different things. This helps, though, stick out your tongue and say ah, along with hypoglossal. So hypoglossal, move tongue side to side. Vagus helps to swallow. So those two we kind of test together. And then accessory spinal, that's shoulder shrug. What I would do, I would focus on this column, all right, on our left. So cranial nerve 1 through cranial nerve 12, and then be able to remember what it does. In the middle, those are just different mnemonics. There's a lot of mnemonics out there to help you remember the cranial nerves, but I'd focus on just the left and that right column. I'll find some videos, I'll post those, of how we would test cranial nerve function. I'll have those posted on Moodle as well. All right, we're going to stop there. I'll start back up with a new video talking about some different eye injuries and eye conditions.